I have a patient with borderline personality disorder, which historically is extremely difficult to treat. There are no medications for it. This poor woman had suffered with depression and daily suicidal ideation for over 25 years. She'd tried to kill herself twice, once by overdosing on medication. And the second time, she almost succeeded. She walked in front of a semi-truck on the interstate, survived with a traumatic brain injury, multiple fractures her shoulder, arms, ribs, in the hospital for just 5 days and got out. We decided to try this to see if it would work for her. And Sam, she's had a remarkable recovery. In fact, we're just about to submit a case study to a journal, medical journal, to report about this because her response was dramatic. Within 9 days, she called me and said, "Oh my God, I've never felt like this before. I hope this lasts." When she came back later, her depression was improving markedly. Her relationships were improving. And by the time she'd been out for a few months, her depression was in remission. She had no more suicidal thoughts. She was working 2 jobs. Her daughter, who previously wouldn't even talk to her for a couple of years because her mother was too emotionally unstable, now was calling her for advice. And she's made a really 100% turnaround. Her depression's in remission. She no longer meets criteria for borderline personality disorder either.
Doesn't dinner sound great as it's cooking? This dinner is from Riverbend Ranch, which always provides prime or high choice. Has never been given hormones, never been given antibiotics, never been given mRNA vaccines. It's raised in the USA. It's processed in the USA. In fact, it's fully vertically integrated, which means that they own the cow that gives birth to the calf. It's raised on their fields and then taken to their butcher and then shipped to you. And if we compare what we can buy from Riverbend Ranch to 4 other major steak companies that sell bundles that have ribeyes and other meat in it, it can be as much as $184 to $59 less expensive. It's a great price value, and it's a delicious piece of meat. Check out mycleanbeef.com/after hours. That's mycleanbeef.com/after hours. mycleanbeef.com/after hours. If you've noticed, I've been wearing this t-shirt for a few episodes now. I have them available on eBay. Check out the links below to get your size.
Welcome to After Hours with Dr. Sigaloff. On this podcast, you will be encouraged to question everything and to have the courage to stand for the truth. And now, to your host, Dr. Sigaloff.
I first want to thank you all for joining me and give a shout out to all of my Patreon supporters. We've got Too Tough giving $30 a month. We have the Anonymous Family Donor giving $20.20. We have the Plandemic Reprimando level at $17.76 with Ty, Charles, Tinvoil, Stanley, Dr. Anna, Frank, Brian, Shell, Brantley, Gary, and Sharon. We have the $10 self-made level with Kevin and Pat and Bev. We have the Refined Not Burned at $5 a month with Linda, Emmy, Joe, PJ, Rebecca, Marcus, Elizabeth, Dawn, Ken, Rick, Mary, and Amanda. We have Addison Mulder giving $3 a month and Frank giving $1.50 a month. And then we have The Courage is Contagious with $1 a month with Jay, Spess Nasty, Darrell, Susan, BB King, Caleb. Thank you so much for supporting me with my endeavors with this show. Please be sure and check out mycleanbeef.com/after hours. That's mycleanbeef.com/after hours. So today our guest, very special man, met Dr. Mitch Liester at the FLCCC conference. Now, we just happened to sit at the same table, and it was a perfect fit. I couldn't have sat at a better table. We had some interesting conversations. We had common interests. But Dr. Mitch, great to see you again. How are things been with you?
Doing very well, Sam. Thanks. It's great to see you too. And thanks for inviting me to your program.
So you're a psychiatrist, correct?
Yes, I am. Yeah, I'm a clinical psychiatrist, an assistant clinical professor in psychiatry at the University of Colorado School of Medicine as well.
And you have a treatment plan or a treatment regimen that you've discovered over the last few years that helps with certain specific disease processes. Can you get into that a bit and kind of explain what that is and some of the results that you've seen with that?
Sure, Sam. I'm happy to, and I also have a slide deck PowerPoint if that will help explain things too.
Yeah.
So briefly, the treatment we're using is a medicine called,
Do you want to get the slide deck
would
set
it be
up?
good to share that now?
Yeah.
Yeah, I can, let me see if I can get it set up for you. Okay, are you able to see that? What I've got here is a PowerPoint presentation to explain this topic of low-dose sublingual ketamine. On the first slide is just a title slide. The second slide, Sam, is just a disclaimer one that we have to put in there because this is a off-label use for ketamine. Just explains that not recommending people go out and try this on their own. They should consult with their doctor. But the real point behind this topic is that a lot of people in this country are suffering with depression. On the third slide, you see that there are over 17 million adults and almost 2 million kids are being diagnosed with depression. So it's a real problem and it's growing every day, probably for a lot of different reasons, including COVID, post-COVID, etc. And the fourth slide explains that a lot of the traditional medicines we've used for treating depression and other psychiatric diseases just often don't work. It leaves people feeling depressed despite the treatment. In fact, on the fifth slide, you see that as many as close to a third of people who have depression are diagnosed with what's called treatment-resistant depression, which means they failed at least 2 trials of conventional antidepressants. They just haven't been effective, which leaves these people suffering. And even the people that do respond sometimes don't have a very good response. And not only that, but on the sixth slide, it talks about how these medicines also the conventional medicines cause a lot of side effects. On the next slide, the seventh, you see that one major class of antidepressants called SSRIs have a lot of side effects. They cause sexual dysfunction, they can cause drowsiness, weight gain, etc., which means a lot of people just don't even want to take these medicines. Sometimes the side effects are worse than the benefits for some people. So we've discovered an alternative on the eighth slide, which is a medicine called ketamine. And ketamine is a very interesting medicine that we'll talk about briefly, but just want to mention that it's an alternative to some of these conventional antidepressants. And in fact, on the next slide, you can see what we're prescribing for people, these little squares of orally dissolving ketamine called troches, Troche. And these ketamine troches are very low dose, and they have a lot fewer side effects than we see with some of the conventional antidepressants. So not only are they safe, they're effective, and they're a lot cheaper as well. The next slide, slide 10, you can see that ketamine does not have some of these side effects the SSRIs have. It doesn't cause sexual dysfunction, doesn't cause weight gain, doesn't cause dry mouth, fatigue, or some of the shaking you can get with some of the conventional antidepressants. Now, it doesn't mean ketamine is safe for everybody, and you should just take it as much as you want. There is a problem with recreational use. On the next slide, the 11th slide, you see a picture of Matthew Perry, who was in the news, unfortunately, recently after he died. The press made it sound like it was because he took ketamine, but they actually had his autopsy posted online, and I took a look at it. Turns out he did have a very high level of ketamine in his system, and it was reported that he was using intravenous ketamine as a treatment for depression, but the level he had in his bloodstream was much higher than what he would have received from those intravenous treatments. So in fact, he was probably using recreationally on top of it. And that wasn't what killed him, though. What happened is he apparently drowned in I can't remember, it was a pool or hot tub, so he probably fell asleep and drowned. But the press made it out sound like he was the ketamine that killed him, which wasn't the case. Next slide, slide 12, it talks about the advantages of the sublingual form, under the tongue form, versus other ways that ketamine is being used. It is being used intravenously. It's even being used intranasally to treat depression, but the under the tongue has much fewer side effects. It's not as expensive, and the benefits last. Whereas with the IV or the intranasal, once you stop the treatment, the symptoms come back. So on the 13th slide, you see the first description of how ketamine came into existence, and it was an interesting story. Ketamine was first synthesized in the 1960s by some scientists at Park Davis Pharmaceutical Company, and they were looking for a general anesthetic to put people to sleep for surgery because the one they were using had some real problems. It was called phencyclidine, and when they anesthetized people for surgery and then they woke up, they would be very combative, agitated. And the other name for phencyclidine is called PCP, or on the street it's called angel dust. And at one point that was being used as a general anesthetic, but it didn't work well. So these scientists came up with an alternative. It's a slightly modified form or an analog, and it's called ketamine. So that was when it was first discovered. It was first approved by the FDA in 1970 as a general anesthetic, and has been used since then as an anesthetic. It's still used today. But a little bit later in 2000, on the next slide, slide 14, you see that some researchers at Yale back in 2000 discovered that if they gave lower doses of ketamine, a sub-anesthetic dose, it actually provided rapid antidepressant effects. Sometimes people within hours or within days would report improvement in their depression. So as a result of that, ketamine clinics have popped up all over the country now where people can go in and get an intravenous infusion of ketamine and their depression rapidly improves. But there are some problems with that. First of all, it's very expensive. Each infusion can run anywhere from $250 to $1,000, not so much for the medicine, but for the time of the physician or nurse monitoring the treatment. People often have sort of a psychedelic-like effect that they don't like. And then again, once the infusions stop, the symptoms can come back. So on the next slide, slide 15, you see that over time they discovered that sublingual ketamine could also be used, and it had some real advantages. This is a study from 2013 showing that just very low doses, as low as 10 milligrams a day under the tongue every 2 to 7 days even, improved depression over 3/4 of the patients who used it in both unipolar bipolar depressions. It was a real breakthrough. But that study just kind of was ignored for a long time. Everybody just didn't even look at it. There's not a lot of money to be made in sublingual ketamine, so I think unfortunately there wasn't much of a profit motive, and that kind of held back the research. Next slide, slide 16, shows that just a few years ago, some researchers down in Brazil discovered that ketamine also occurs in nature. They were looking for treatments for parasites and came upon this fungus that would kill parasites. They took the fungus back to the lab to see what it was making, and it turns out it was making ketamine. So you can actually find ketamine in nature if you know where to look. So one of the big questions, the next slide 17, is how does this work? How does ketamine treat depression? It's an anesthetic. It's used for other things. Sometimes doctors prescribe it for pain management as well. But how does it work for depression? Well, slide 18 shows it actually promotes neural regeneration, or it stimulates the nervous system to grow and repair. And it does this in slide 19 by increasing a protein that we have in our body and in our brain called BDNF. It stands for brain-derived neurotrophic factor. So what is this magic protein that stimulates our brain and to grow? Slide 20 shows it's, again, BDNF. And the next slide, 21, shows a picture from some researchers back at Yale when they took a picture, an electron microscope, of neurons before and after ketamine. And what you can see in this picture is that the top red line is a nerve or a nerve cell, a neuron from a rat that shows a couple little bumps on it. These are called bulbs or spikes. And these bulbs or spikes grow out and connect with bulbs or spikes on other neurons and create connections called synapses. And the bottom picture shows that after ketamine treatment, these bulbs or spikes grew. There were quite a few more of them. And that was because of the BDNF. It actually stimulates the nerve cells to produce new synapses. There's one other interesting thing about ketamine on the next slide, 22. In late 2022, some researchers at MIT wrote a paper about something called silent synapses. And these are connections in the brain that are dormant and they're just asleep. They're not functioning. They're missing a protein that they need to turn them on. And they say as many as a third of the connections or synapses in our brain may be these dormant or silent synapses. And it turns out the protein that's needed to turn them on is something that ketamine triggers the production of. So ketamine may be actually waking up our brain in ways that hadn't been predicted before. And just a few more slides. Slide 23 shows that the response to ketamine varies with the dose. At low doses, you don't see much response, but as you increase the dose, the body starts producing more of this BDNF, which I think of as miracle grow for the brain. Stimulates the growth of the nerve cells. New nerve cells are produced, new connections are produced. But if you keep increasing the dose, you actually do more harm than good. If you go too high, the brain stops producing BDNF. You actually get a damage to the nerve cells, something called excitotoxicity. And so excessive use of ketamine is not a wise choice. You want to keep the dose down. On the next slide, 24, just explains that with ketamine, you start seeing improvement in depression. And with the sublingual ketamine, it's slower than the IV, but it's more long-lasting. We're seeing really some dramatic changes in people who have not responded to antidepressants for decades. And after sometimes a month or two of this under-the-tongue ketamine, they're going into remission. They're feeling markedly improved, and those benefits last. And they continue to grow, so that even though in the first month or two, people may improve in terms of their depression, over time, other things improve. Their anxiety gets better. They sleep better. Their PTSD improves. Their ADHD improves. Their obsessive-compulsive disorder improves. And it just keeps going. After a year or so, we're even seeing some pro-cognitive effects. People's memory is improving. Their ability to learn improves. People are reporting their intuition improves. It's just seeing some really remarkable results. And on the next slide, last slide actually, this is a copy of a poster we presented at the World Psychiatric Congress last year in Vienna, Austria, showing our results with the first 49 patients we treated with ketamine. It's a little bit complex, but it just shows that 96% of the people who we treated with this sublingual ketamine improved to varying degrees. About a third got about 50% better, about a third got 50 to 75% better, and then about 25% went into total remission, no more depression. And only 4% of the people showed no response. And this slide also includes the protocol we used and some possible ways that it works. So what we're hoping is that by putting this information out there, some other doctors will learn about it and start using it as well. We do have doctors now in Phoenix that we know, some colleagues in Tucson, as well as Denver. They're trying this and having also remarkable results as they're starting to spread the word as well. So that's the message I wanted to pass on to folks that are interested, is there's a new treatment for not just psychiatry based disorders like depression, anxiety. We're also seeing some improvement in neurologic disorders. People are spontaneously reporting improvement in peripheral neuropathy. We're also trying in a patient with ALS. Also have seen my colleague here in Colorado Springs, Dr. Rachel Wilkinson, has had some success reversing dementia in some patients, and also seeing some evidence of brain regrowth after sustained treatment with this ketamine.
This is incredible. This seems like it's a miracle that you have found and that you have helped discover.
Well, when it first came out, I was very skeptical, to be honest with you. It sounded a little too good to be true. When my colleague, Dr. Wilkinson, said, Mitch, you won't believe the results with this, I thought, yeah, I've heard that before. But I've known her for a while and trust her, so I decided to try it. And it was kind of funny because in the beginning, she said, you're going to see results, just tell people to be patient. And so people would come back after a month or two on the medicine, and they were 50% better. And I would send her a text in the middle of the day, say, Rachel, I can't believe the results. This is amazing. I've never seen anything like this. And she'd text me back and say, Mitch, calm down. It's going to get better. And sure enough, patients would come back a month or two later, they'd be 75% improved. And I'd text her again, said, Rachel, I don't believe the results. This is amazing. She'd text me back again, say, Mitch, calm down. It's going to get better. I said, how can it get better than this? She said, give it a few more months. People will be in remission. And she was right. And I had to text her back after that and say, I apologize for doubting you. I didn't believe this is possible. And she confessed to me. She said, I didn't believe in the beginning either. She said, I didn't think this was going to be as good as it is. But she had been prescribing it at that point for 2.5 years, had over 200 patients on it. And again, in the beginning, I thought, why would any doctor have 200 patients on this new treatment? Well, Sam, I'm just about there now. I think I've got about 180 patients on it because they're doing so well. I don't want to deny people the opportunity to get better.
Wow, this is incredible. So go through a list of some of the things that you've personally seen it work better and your colleague has seen it improve. So you mentioned OCD, PTSD, depression, ADHD.
Yes, it's really, I have a patient with borderline personality disorder, which historically is extremely difficult to treat. There are no medications for it. This poor woman had suffered with depression and daily suicidal ideation for over 25 years, just miserable, and no medicines were helping. She'd tried to kill herself twice, once by overdosing on medication, and the second time she almost succeeded. She walked in front of a semi-truck on the interstate and survived with a traumatic brain injury, multiple fractures, her shoulder, arms, ribs. She was in bad shape. They took her to the ICU. She's in the hospital for just 5 days and got out. We decided to try this to see if it would work for her. And Sam, she's had a remarkable recovery. In fact, we're just about to submit a case study to a medical journal to report about this because her response was dramatic. Within 9 days, she called me and said, oh my God, I've never felt like this before. I hope this lasts. When she came back later, her depression was improving markedly. Her relationships were improving. And by the time she'd been out for a few months, her depression was in remission. She had no more suicidal thoughts. She was working 2 jobs. Her daughter, who previously wouldn't even talk to her for a couple of years because her mother was too emotionally unstable, now was calling her for advice. And she's made a really 100% turnaround. Her depression's in remission. She no longer meets criteria for borderline personality disorder either.
Wow. Like, there's nothing for borderline personality disorder. Those people live this terrible self-destructive life for the rest of their life. And, explosion of relationships over and over and over. And it's changed. She's no longer meets criteria. That's incredible.
Sam, it's one of the most amazing things. I've been practicing for almost 40 years now. I've never seen anything like it. And the joy now in my practice is seeing people coming in who are doing so much better for so many different causes. Yes, you asked about other conditions. So in psychiatry, it's also working for people that struggle with bipolar disorder, which can be difficult to treat.
Wow.
Partly because antidepressants can make the condition worse by triggering what are called manic episodes. The ketamine doesn't do that. So it's providing mood stabilization as well as treating their depression. So they're improving. They're improving so much, Sam, that a lot of the people we're treating now are getting off their conventional medications. They don't need antidepressants after a while. They don't need ADHD medicines. They don't need medicines for PTSD or OCD or ADHD. And so that's remarkable to see after maybe a year or two. And then Dr. Wilkinson, who's been now prescribing for over 4 years, tells me that some patients after about 3 years don't even need ketamine anymore. So it's as if it's healed their brains, and they have remained stable for up to 6 months so far, even without ketamine, no medication whatsoever. So we're really excited about the potential to help people with this medicine.
So kind of walk me through like a treatment regimen, how it works, how it looks
Sure.
from your side, and then what the patient typically sees during that time frame.
Absolutely. So Dr. Wilkinson developed a protocol. I call it the Wilkinson protocol because she's the one that was smart enough to come up with it. And we're using it as a starting point. And what we do is we have people start with just 25 milligrams of ketamine. They put it under their tongue at bedtime. And the reason for that is some people feel a little bit either mildly tipsy, some people describe it as like they've had a glass of wine, or a little bit mildly dizzy if they get up and walk around. So if they lay down at bedtime, they just fall asleep. And that if they do experience that mild tipsy feeling, it's very short-lived, usually between 5 minutes and an hour. Some people find it pleasant. They kind of like it. They just relax and fall asleep. Some people don't even feel it. And so they take 25 milligrams under their tongue every third night for 4 doses. After that, they take 25 milligrams under their tongue every other night for 4 doses. And then they increase to 25 milligrams every night. Now, we give it some time. Usually within 1 to 4 weeks of that dose, people start noticing improvement, and it's gradual. If they don't respond, then we can increase the dose. And in some instances, that 25 milligrams is a little too strong for people. So we've actually had people who've cut back their dose. So the range we're finding that's effective can be anywhere from the lowest I have anybody on is 6 milligrams, and the lady's taking it every third day, only twice a week, and she's doing marvelously. And there are some people that take doses as high as 150 milligrams to 175, and they do well at that dose. So each individual responds differently. So we just start low, go slow until we find the dose that works optimally for people, and then we stay at that dose because the benefits keep accruing for a year. There are even additional benefits the second year, and Dr. Wilkins tells me even more benefits the third year. So we don't have to keep increasing the dose. We just keep people at a steady state dose.
So when you say the third year of the same treatment dosage.
Correct. Yes. And in fact, some people, she tells me, I've only been prescribing this now for a little over a year, maybe a year and a quarter. She's been doing it for 4 years, and says that some people after about that third year start finding they just don't need the ketamine as much. She starts cutting back on the dose. And then, like I said, some people wean off of it, just don't need any medicine any longer. And it kind of makes sense, Sam, that what we're seeing is a lot of these conditions we've been treating for years, we thought were due to chemical imbalances in the brain, but it's starting to look like it's more likely due to inflammation in the brain, which could be caused by a variety of things: systemic inflammation, autoimmune disorders, stress. A lot of things can cause inflammation in the brain, or what's called neuroinflammation, and the ketamine repairs that. So instead of treating symptoms, we're really getting to the root cause of their conditions, we believe, and it's making a huge difference for people.
That's amazing. I love getting to the root cause of things. And one thing that I'm a huge advocate and love talking about is diet and how that gets to the root cause of even brain inflammation.
Well, and that's interesting you mentioned that, Sam, because I just recently was at a conference where they talked about dietary interventions for not only psychiatric disorders, but medical disorders. And they were reporting through some dietary changes, some very similar results to what we're seeing, even the ability to get patients with severe psychiatric disorders off their medications. Dr. Chris Palmer from Harvard was talking about a patient with chronic schizophrenia for 40 years who, after dietary changes, was able to get off her medication, remain symptom-free for the next 15 years of her life. And I was curious about that. I mean, patient after patient was being described who, with bipolar disorder, schizophrenia, depression, was able to improve with dietary changes very similar to what we're seeing with ketamine. So I reached out to Dr. Wilkinson, my colleague, about this, and I said, how is this possible that we're getting similar results? We found out that certain types of dietary changes, particularly low-carb diets, can also release BDNF in the brain, the same sort of miracle-grow product that stimulates the brain cells to grow. So it looks like we probably found 2 different pathways that converge at healing and repairing the brain, and not just the brain, but the remainder of the body as well.
Now, I want to mention that if anybody wants to learn more about Dr. Chris Palmer, he was recently on a podcast with Dr. Jordan Peterson. And he talks about that case who had, that patient who had, was it schizotypal or some personality disorder, and completely reversed their disease just by changing their eating habits, doing extremely low carb. I think they were doing carnivore.
I believe it. And I think, Sam, the problem is, as you know, most of us physicians got little or no training about nutrition in medical school. And so I got zero, not 1 minute. And so really wasn't aware of the potential benefits. I'm fortunate that my oldest daughter is a registered dietitian. Has been trying to educate me for a long time about these benefits. And I was a little skeptical in the beginning, but now I'm seeing it. She's reversing all kinds of medical conditions. Patients with diabetes are improving. Some of my patients now that she works with are having significant improvement in their mental health. So I think, yes, I think dietary interventions are hugely important. And we're starting to combine dietary interventions with ketamine to try to boost the response people are getting. So we're starting to publish some papers, hopefully very soon, about this. And I hope we'll have more to publish in the future. And hopefully we can stimulate other people to do some research as well.
One thing you mentioned in your presentation, you said excessive use. When you have excessive use, the return becomes less, and it actually can be seemingly harmful. By excessive use,
Yes.
do you mean dosage at one time, or same dosage over time? So like same dosage every day for multiple days in a row?
Yeah, great question. So there are two things that can happen with higher doses of ketamine. The first thing is you actually shut off production of BDNF instead of increasing it. If you go to too high of a dose, single dose, you don't get any BDNF release. That's one problem. The other is something called excitotoxicity, which is a process that occurs when you have too much of a amino acid that's also a neurotransmitter called glutamate in the system. And in the brain, if you have too much glutamate, it damages neurons, it kills them. And ketamine does work on glutamate. So stimulating a little bit of it can be helpful, but too much is not good. It's like what we learned in medical school. The only difference between a medicine and a poison is the dose. And that's certainly true with ketamine. So you can actually reduce healing of the brain if you go to higher, but if you go excessively high, you can actually damage the brain. And that's where people need to be careful at using it recreationally, because if they go too high, they're going to actually do some damage.
And when you say recreationally in those high doses, are those the kind of doses that drug users and abusers, when they call keyhole, when they just kind of disappear into nothingness? Is that the kind of high dosage that you're talking about?
Probably, yeah. At higher doses than we're using, ketamine has very different effects. Again, at the low doses, it hardly has any perceptible effects on consciousness. It's very mild, if any. As you go up on the dose, like with the IV doses, which are still safe, and that's about usually a 0.5 milligram per kilogram is the typical dose that they infuse over about 40 minutes intravenously. People have psychedelic-like experiences, but they're not doing damage to their brain. But unfortunately, recreationally, some people go much higher using ketamine. And when they do that, yes, they go into the keyhole, where they have not only profound changes in consciousness, but again, sometimes they have neurotoxic changes to their brains as well. And that's not a good thing.
So kind of walk me through the patient experience and like how they take the medication, because you mentioned they look like little pieces of paper, or is it a liquid, or how does that work from their perspective? And then
sure. Yeah, sure, Sam. It's a gelatinous-like substance that the pharmacy makes. It has to be made at a compounding pharmacy. The average pharmacy, your local pharmacy, won't have this. It doesn't come from the pharmaceutical companies this way. It has to be made. And we have a wonderful pharmacist here in Colorado Springs that knows how to make it, and he's been doing it for several years. Now it's spreading. There are also pharmacists. We work with pharmacies in other cities around Colorado, and I know there's a friend of mine, a compounding pharmacist in Mesa, Arizona, and also makes sublingual ketamine, these ketamine troches. So what people do when they get them, each troche is typically, that we make, is 100 milligrams. So the patient cuts it in fourths and just puts a quarter of that little square into their tongue. And what people describe oftentimes initially is the taste is unpleasant. It's got a bit of a bitter taste. So the pharmacies will often put a flavoring in it. Sometimes they use wintergreen. I've had patients have bubblegum flavored, or cherry marshmallow, cotton candy, all watermelon, all kinds of flavors, try to cut that bitter taste. But it's not bad enough that anybody stopped the medicine because of the bitterness. Some people say it's not bad at all, and they use it unflavored. And once it's under their tongue, people start feeling relaxed and calm typically. If they feel anything, some people feel nothing. And that calm, relaxed feeling helps some people just fall asleep. Occasionally, maybe less than 10% of the time, some people have an opposite reaction where they feel energized, like they've had a cup of coffee. If that happens, we have two options. We can either cut down the dose to relieve that, or some people take it earlier in the day instead of at bedtime. And if they do that, I just ask them not to drive for an hour. The reason being that if they do feel that sort of tipsy feeling, we don't want them on the road. And that passes usually in less than an hour. And that tipsy feeling, like I said, for some people is very pleasant. If people get up and go to the bathroom during the night, they can. They feel a little lightheaded or dizzy, but nobody's hurt themselves or fallen from that. And then that wears off within an hour. And the next morning, people feel nothing. It has a very short half-life, which means it's out of our system after taking it sublingually, probably within about 10 hours or so. So if you take it at night, by the time you wake up in the morning, the medicine's out of your system and you just go on about your normal day. And the biggest challenge for people is to be patient, because most of the time for the first 4 to 6 weeks, people feel nothing. And then very gradually, once the medicine starts working, they start noticing just gradual improvement. They say that I'm feeling a little bit less depressed or a little less anxious, or I'm sleeping a little better. And then that gets progressively worse. There are some ups and downs over time, but the gradual improvement is pretty noticeable. I sometimes tell people it's like watching your own hair grow. From day to day, you don't see any change, but week to week or month to month, you know when the hair is getting longer. And that's what people describe with the medicine. There are some fast responders. I had one lady that went from severe depression to no depression within 1 month, but that's unusual. Usually that takes 2 or 3, maybe even 4 months. But people do notice gradual improvement. And then it's interesting because people start adding additional comments about additional observations they've made. For example, I've heard the word resilient more in the last year than I've heard in my whole career. People come in and say, I'm just more resilient. I can just handle things better. The things that used to bother me just don't bother me as much anymore. And people are describing some really remarkable changes. Past traumas, things that have happened to them in their childhood or when they were younger, just that used to bother them still, that doesn't bother them anymore. They said, I've dealt with it, I've thought about it, it just doesn't have the same impact on me anymore. People are even healing relationships that have been broken for decades. And this resiliency is really amazing. And it allows people sometimes to also think creatively and problem solve. And it doesn't mean people are more passive. People sometimes are getting out of jobs that weren't working for them because they say, I just don't have to put up with that or tolerate it anymore. I was before, I felt like I just had to hang in there. Now I don't feel that way anymore. So people are finding it easier to make constructive changes in their life as well. And that's kind of fun to hear. And then sometimes we're even hearing spontaneous reports of improvement in neurologic conditions. One of the most common is peripheral neuropathy. I must have had 7 or 8 patients just voluntarily say, Dr. Liester, I not only feel less depressed, but my peripheral neuropathy pain is either markedly reduced or it's gone. Now, not everybody experiences that, but a high percentage of people do. I'm also hearing people report their fibromyalgia is better now. And people are even saying, I think it's because I'm emotionally more stable. I don't feel the stress I felt before, and my fibromyalgia pain is just improving. It's really fun to hear all the different things that people come in describing, all the different kinds of improvement. I had one gentleman who had post-COVID symptoms. He lost his smell and taste and had tinnitus or ringing in his ears for 7 months. We started him on ketamine for depression, and his tinnitus went away quickly, and his taste and smell are starting to return finally for the first time. So we're just getting a lot of reports of additional kinds of benefits. I'll tell you one other. My sister even was started on it. She has a neurologic condition, a pain disorder called CRPS, complex regional pain syndrome. And she also had damage to the ulnar nerve in her left arm from a car accident 30 years ago. So her doctor put her on the ketamine because it's reported to help with CRPS. But what she didn't expect was that the damage in her left ulnar nerve, which caused her left pinky finger and ring finger to be numb for 30 years, suddenly got better too. And she can now feel those fingers for the first time in 30 years after taking ketamine. We didn't expect that. And I keep checking with her, can you still feel those fingers? And she can. It's been months now, and it's still the same.
How long on treatment before she could feel that finger back?
I don't remember exactly how many months, but it was a few months. Within maybe 2 or 3 months, she started noticing improvement. And also her CRPS, her feet had been numb, and they're no longer numb after treatment with the ketamine.
Wow. I mean, just everything that you're mentioning, I can picture a patient in my head that I think might benefit from this, because we all, if you're in this profession, we all have patients that have these incurable problems, and it's just so heartbreaking that we can't offer anything.
Exactly, Sam. And that's what's made this so much fun for me, is that people that used to be considered treatment resistant, there was no hope for them. Now there's not only hope, but significant improvement. And I think that's why it's spreading so fast. And when I've told some of my colleagues about it, at first they were very skeptical, but as I was in the beginning, but it's so much fun. I just got a call from a psychiatrist friend in Denver last week. She's saying, Mitch, I have to talk to you. I've been using your sublingual ketamine protocol. It's working great. Can we talk? I said, yes. So we got on the phone, and she was describing how much improvement she's seeing. I also have a friend who's a practicing physician in Mesa, Arizona. He says the same thing. I have one other colleague here locally in Colorado Springs. He's a neuro-oncologist, a very, very bright neuro-oncologist. when I first told him about this, he was very skeptical and said, "Show me the studies." So I did. I sent him several studies showing this how this worked. He read them. He said, "This looks like it might work. I think I'll try it." And when I saw him the next time, a month or two later, he said, "Mitch," he said, "it's working great." He said, "A lot of my patients are responding." He said, "The biggest problem I'm having, though, is when I try to talk to my colleagues, the other neurologists, they don't know anything about it, they don't understand it, and they won't take the time to read the papers." He said, "They're just not considering the possibilities." So he said, "I'm having a hard time convincing my colleagues to try this." But he said, "I'm having great success with it." So I think that's the challenge, Sam, is that most physicians aren't yet aware of this. They don't understand it, and so they're a little hesitant to try it. But I'm hoping that through your podcast, thank you, and through other podcasts we're doing and papers we're writing, that hopefully physicians will become more familiar with this treatment and begin using it themselves. Because any physician can prescribe ketamine as long as they have a DEA license. It's what's called a Schedule III medicine. So it's lower on the scheduling than even something like Adderall or many narcotics. So it's easy to prescribe. You just need to find a compounding pharmacist that will make it. And the cost is also important. I should mention that. I talked about earlier how these intravenous infusions can run thousands of dollars for people over time, which is just cost prohibitive for a lot of people. The ketamine troches, when they make the 30 little squares, it's approximately $60. And if people stay on just the low dose 25 milligrams, that will last them 4 months. So we're talking maybe $15 a month. And even if they increase their dose, it's typically not more than maybe $30 a month. So it's very affordable for people.
That's incredibly affordable compared to, $600 for an IV session that you do maybe 3 or 4 of those a week for 6 weeks.
Exactly. So it's less expensive, fewer side effects, and lasting benefits over time, which is really exciting. So I think going forward in the future, I think this will probably become the future or the treatment of choice for many disorders once people learn about it. And if further studies confirm our results, but it's really remarkable, and it's just such a joy to see people improving.
Have you seen anybody with brain injuries, like let's say stroke or traumatic brain injury? I think you mentioned one patient, your borderline personality, did have some traumatic brain injury, but to help improve with those specific symptoms.
Yeah, it's a great question. Yes, I'm working with another young man who unfortunately had a couple of severe traumatic brain injuries. He was in high school. He was camping in the mountains near where we live here. It's pretty common for the kids to go up camping in the mountains. And he decided in the middle of the night that he didn't want to stay. So he was driving down the mountain by himself and went off the side of the road. And his car tumbled a couple hundred feet, and he was stuck in a gully down below, and he couldn't get out of the car. And yelled for help. There was nobody out. It was the middle of the night. He was there for hours until the next day when somebody happened to be driving along and heard him screaming. They flight for life into the local hospital. He had a significant traumatic brain injury. Recovered from it, but later had a second car accident with another traumatic brain injury that left him disabled for years, living at home with his mother and father, struggling just to get through the days, very depressed, very irritable, cognitive impairment. So we decided to try it for him, and he's doing wonderfully. He's much more happy. He's not depressed. He's not so angry. He's becoming more social. So we're seeing some real progress. And I'll tell you briefly about a patient, Dr. Wilkinson's, who was experiencing some atrophy of her occipital lobes in the back of her brain. And this was documented by MRI. She was seeing a local neurologist, and Dr. Wilkinson put her on sublingual ketamine. And after 9 months, her functioning started improving. So they, at that point, did another MRI and saw that her occipital lobes were regrowing. There was actually regrowth in the back of her brain, which was not known to be possible.
That can't happen, allegedly.
That's what I was taught, Sam. But we've got MRI evidence to document that it did. So that's pretty exciting when we start seeing. It's kind of a paradigm buster. Yeah, it can do things we just didn't know it was possible doing. And the nice thing about this, too, is, we're not the only ones looking at this. There are some folks at UC Davis in California who have come to understand that there are medicines that can stimulate the brain to grow and repair. They've put a new name or label on these medicines. They call them psychoplastogens, which is a big name. But they say these are medicines that stimulate the brain to grow and improve both functionally and structurally. And they're looking for additional medicines that will do the same thing. What's odd about this is that many of the medicines they found to do this already are what are called psychedelic medicines. Medicines like psilocybin does the same thing in their lab. It stimulates the release of BDNF, but these medicines aren't yet available most places. They may become available. There are clinical trials demonstrating that psilocybin can have very beneficial effects similar to the ketamine, but they're not yet legally available. In the meantime, ketamine is legally available, so it's much easier to use.
Yeah, some of those things you mentioned were Schedule 1, which means no medical use, but ketamine Schedule 3, which means it's even easier to get to your patient. That's incredible.
It's very easy. It just takes the pharmacy a day or two to make it, and they get started on it, and then you get to wait to see them back and see how they're doing. Now, I will mention again, it doesn't work for everybody. We do have a small percentage of people who don't seem to benefit. We don't know why yet. There may be a variety of reasons. I did have one gentleman who was doing great on it and then started to relapse back into depression. I asked him, has there been any change in your life? He said, no. I said, are you doing anything differently? He said, the only thing I'm doing differently is having a few drinks at night. I said, well, how many? He said, maybe 3 to 6 beers a night. I said, well, can you cut back on that a little bit? He said, sure. So he came back next time. He was doing well again. He said, I just stopped drinking. I just didn't need it. So we do know that excessive amounts or higher amounts of alcohol interfere with ketamine. And we believe the mechanism may be that it's causing inflammation in the brain. We know that alcohol can inflame the brain, especially at higher amounts. So that may be one reason some people don't respond. There may be other reasons that some people don't respond. We don't know what they are yet. But I think as research continues, hopefully we can find out what some of those barriers are and work around those as well.
That's incredible. That's the most amazing thing I've heard all year, to tell you the truth.
I got to tell you, Sam, it's a lot of fun being a psychiatrist these days and being able to help people, especially some of these folks that I've been working with for years that, really there wasn't a lot of hope for. I mean, we kept trying different things, but nothing was working. And suddenly now, they're coming in and telling me not just how well they're feeling, but their friends they're telling about. I have one lady, when she goes to church, she's telling everybody at church, that they need to try this if they have these problems because she's had such great results. I said, well, it's not for everybody, and they need to get in to see their doctor for an evaluation first. But people are promoting it because of the great results they're having, and they're so happy with it.
It's great to see treatments that are actually safe, actually effective, and people are happy to tell their friends to go see doctor to get this for yourself because it's helped me so much. It's good to see that coming back to the world.
It's wonderful. It's wonderful that people, and it's affordable. People can do this treatment. Anybody can just about can afford this. And so it's accessible, which is nice. I mean, some of the new medicines, when they come out in psychiatry, some of the antidepressants, the ADHD meds, they may be $700, $1,000 a month. That's just not accessible. And for some people, even if they have insurance, the insurance won't cover these medicines. They're too expensive. So it really has hampered people's access to mental health treatment. But this one is pretty affordable for just about anybody. So I think we're going to be able to help a lot more people with it also.
Wow. When you get to a point where you have more information or another paper published, you have access to my show anytime you want. Just let me know.
Well, thank you, Sam. I appreciate that. Well, we've got several papers that we're submitting. Like I said, we do have the case report of the patient has borderline personalities or had borderline personality disorder, doesn't anymore. We're also hoping to submit a paper. We've looked at the potential of ketamine to heal spinal cord injuries. There's reason to believe that it may help those with spinal cord injuries because of this neuroplastic effect that it has in the nervous system. There's an interesting case report of a man here in Colorado who wasn't on ketamine, but he was kite skiing, which I had to look that up and see what that was. He was out skiing in Chile, South America, with a parachute-like device, a kite that would carry him across the plains on snow. And when a gust of wind picked him up and slammed him into the ground, and he fractured 9 vertebrae and was paralyzed from the chest down. He had spinal decompression surgery, went into rehab, and he got to where he was able to walk with a walker, but still was pretty much paralyzed. He went to a concert, and some friends gave him some psilocybin mushrooms, and he started feeling muscles firing in his legs that weren't firing before. And he continued to take it, and now he's able to mountain bike, ski, he's walking. And so that led us to think, what is it about psilocybin mushrooms? Well, it turns out they're one of these psychoplastogens that stimulate the nervous system. But a lot of people with spinal cord injuries may not want to take psilocybin, but could ketamine potentially do the same thing? And we found out that there are studies showing that other psychoplastogens do show evidence for helping heal spinal cord injuries. So we hope to suggest this and put a paper out there so maybe some neurologists will pick it up and do some research into it.
Wow. That's just a miracle. I mean, making the lame walk kind of miracle.
It's amazing. The things we're seeing really, truly are miracles considering what past medicine could and couldn't do. We're doing things that didn't happen before. And it's so wonderful to be able to help people in this way.
Yeah. And with the occipital lobe regrowing, that's the blind scene. I mean, it's all that.
Sam, it's amazing. Yeah, that that case is supposed to be presented at Harvard Medical School this year. They've asked the patient to come to Harvard and talk about her case because they want to understand what happened, because that shouldn't normally happen, but it did.
Wow.
And they have, like I said, radiographic evidence. They have MRIs showing it worked. And we ran this by our friend, the neurologist, just to make sure we weren't imagining things. He said, no, this is truly remarkable.
Wow. That's incredible.
So, yep. So we're hoping that thanks to your podcast and others, that maybe more people will learn about this, hear about it, and pursue it. I don't think we have all the answers. I think we're just scratching the surface, but we need help, doing research and getting more people out there exploring this and finding out, maybe are there other regimens of dosing that might work better? Are there different doses that might work better? We're going with what works for us, but I'm sure there's still a lot we can do to improve what we're doing still too. Even adding in things to boost the effectiveness of the ketamine are possible studies that could be carried out in the future.
Yeah, diet mixed with ketamine might have even faster improvement.
Absolutely. That's one of the things that excites me the most. Yeah, making dietary changes that we know stimulate BDNF, and exercise. We know exercise stimulates BDNF, not at the level that ketamine does. But yes, what if you start combining treatments? How much better could that be for people? And maybe it would accelerate the growth. We don't know, but it's possible.
That's amazing. Well, Dr. Liester, thank you so much for coming on with me, sharing so much. This has been just shocking. I've just been standing here just like, wow, I know a patient that could help. I know a patient that could help. And, I've got them in my mind of who I would like to try this for if they'd be willing to try it.
Well, Sam, I know a good pharmacist in Phoenix that can get you the medicine if you decide you want to start prescribing it for your patients.
Awesome. And if people want to get a hold of you, is there a way that people can look at your work or find your papers, or should they go to NIH and search your name?
Yeah, I don't have a website. I'm old, and so I haven't got my own website. So there are a couple of places they can go through. They can Google my name. They can. There's a website called ResearchGate that can be accessed by academicians, where I've published all the papers we've done so far. And they can also write to me. I'm not taking new patients, but I'm glad to share information. My email address is dr.liester@proton, proton.me, and I'll be glad to send people whatever information I have. I have tons of papers, many papers about ketamine and its therapeutic use, and I'm glad to share information with anybody that wants to read about it and learn more.
Well, thank you so much. I am so grateful that you were able to come and share your vast wealth of knowledge on this particular subject that I've never heard about before. And I am so grateful to God that you and I just happened to sit at the same table and start talking about these things.
Well, Sam, there are no coincidences in life. I don't think it was an accident. I was so happy when you sat down at the table too, and I'm so thrilled that we met and that we're getting to continue as friends and colleagues, and I hope we continue this collaboration and relationship.
Yes, sir. God bless you, and keep doing His work.
Thank you, Sam. We're going to do our best. You too.
Just a reminder for everyone out there, duty uniform of the day, the full armor of God. Let's all make courage more contagious than fear. Doesn't dinner sound great as it's cooking? This dinner is from Riverbend Ranch, which always provides prime or high choice. Has never been given hormones, never been given antibiotics, never been given mRNA vaccines. It's raised in the USA, it's processed in the USA. In fact, it's fully vertically integrated, which means that they own the cow that gives birth to the calf that's raised on their fields and then taken to their butcher and then shipped to you. And if we compare what we can buy from Riverbend Ranch to 4 other major steak companies that sell bundles that have ribeyes and other meat in it, it can be as much as $184 to $59 less expensive. It's a great price value, and it's a delicious piece of meat. Check out mycleanbeef.com/after-hours. That's mycleanbeef.com/after-hours. mycleanbeef.com/after-hours.